PA projection, weight-bearing method, right and left bending. Position of the patient. Perform this examination with the patient in a standing position. Duncan and Hoven recommended that the PA projection be used because in this direction the divergent rays are more nearly parallel with the intervertebral disc spaces. Port position. With the patient facing the vertical grid device, adjust the height of the IR to be at the level of L3. Adjust the patient's pelvis for rotation by ensuring that the asses are equidistant from the IR. Let the patient's arm hang unsupported by the sides. Make one radiograph with the patient bending to the right and one with the patient bending to the left. Have the patient lean directly lateral as far as possible without rotation and without lifting the foot. Ensure that the mid-sagittal plane of the lower lumbar column and sacrum remain centered to the grid device as the upper portion moves laterally. The central ray is directed perpendicular to L3 at an angle of 15 to 20 degrees caudad or projected through the L4 to 5 or L5 to S1 interspaces if these are the areas of interest. PA and lateral projections of the thoracolumbar spine for scoliosis. Scoliosis is an abnormal lateral curvature of the vertebral column with some associated rotation of the vertebral bodies at the curve. Diagnosis and monitoring of scoliosis requires a series of radiographs that may include upright, spine, and bending studies. A typical scoliosis study might include the following projections: PA or AP upright, PA or AP upright with lateral bending, lateral upright with or without bending, and lastly PA or AP prone or supine. The PA or AP and lateral upright projections show the amount or degree of curvature that occurs with the force of gravity acting on the body. Because scoliosis is generally diagnosed and evaluated during the teenage years, proper radiographic techniques are important. Ideally, large film screen systems on grids such as 14 by 36 inches or 35 by 90 cm are used to show the entire spine with one exposure. To expose the length of a 36-inch or 90 cm IR, a minimum of 60-inch or 152 cm SID is used. Radiation protection is crucial. Collimation must be closely limited to radiate only the thoracic and lumbar spine. The gunman should be shielded by placing a lead apron at the level of the asses between the patient and the X-ray tube.